are going to have what we call our Power and Progress panel. And if our panelists would please make their way up to the stage. And while they're doing that, let me give you a little background. For our first two anniversary celebrations, we had people who had returned after incarceration serve as panelists, allowing us to better understand the challenges that they faced and the way that they had battled through adversity. Some of those former panelists are with us today. In turn, that gave us insights into how we as a society can improve providing support to them and how we as OurJourney can do our job better. After all, we all benefit when people who return to our communities after incarceration fully integrate back into society. This year, we're going to continue the tradition of having a reentry panel, but with a twist. This year, we have invited 3 leaders from across the state and from different positions of power to answer tough and difficult questions about how people in leadership positions across North Carolina can shape or perhaps reshape reentry policies. And I look forward to moderating this discussion. But then, after I ask some questions, we have a special treat. 3 formerly incarcerated individuals who are with us today will ask a unique question to each of our 3 panelists. And I know we are running a little bit later than we had expected, so we may not have time for all of the questions that I had prepared as a moderator, but we will definitely make sure that we have time for our questions from our formerly incarcerated individuals. So it's a privilege for me to introduce our panel to you today. And we had one person who was going to be with us today who was not able to, Mayor Leo Williams, who had mayoral duties to take care of in Durham. So we have graciously had someone who at almost the last minute has filled in, and I look forward to having his contributions. Let me introduce you. First of all, we are starting here on the left. This is the gentleman that is taking the place of Mayor Williams. This is Shabbar, and I want to make sure I pronounce it correctly. Ranapurwala, did I say that correctly? Close enough? Yep. Thank you, very good. Shabbar is the Associate Professor of Epidemiology in the Gilling School of Global Public Health at UNC-Chapel Hill. He currently leads 4 studies funded by the NIH, the CDC, and DOJ to prevent drug overdoses, suicide deaths, firearm violence, and intimate partner violence in the U.S. If you've ever heard me speak around the state, oftentimes I will talk and I will say that you are 40 to 50 times more likely to die of an opioid overdose during your first 2 weeks after release from prison than the average person. That study comes from research that Shabbar led at UNC. It was my honor to meet him last year. I wanted to find out, I've been quoting this research. I wanted to find out, talk to the person who actually did it. Reached out, he graciously agreed to meet with me, and today he has graciously agreed to be a part of our panel. So let's please give Shabbar a good hand. Thank you. Next is Brandi Matthews. Brandi Matthews is a longtime friend, and she is a longtime friend of many people in this room. She holds many jobs and responsibilities in Goldsboro. She is a teacher at the Wayne Community College. She is also the reentry coordinator for the Wayne County Reentry, the LRC, Reentry Council there. And if that's not enough, she is in her second term second term as city councilwoman. So please welcome Brandi Matthews to the panel. And then finally, we have Assistant U.S. Attorney Rob Lang. Again, a friend to many people in this room. I first met Rob, almost 3 years ago now. They were doing a reentry simulation in Rowan County, downtown Salisbury. I'd never been to a reentry simulation before, other than the real one that I went through. And I went and I was like, who is this crazy guy who is so passionate about what he's doing and is just so into it? If you've ever been to a reentry simulation and Rob Lang was not the facilitator, you haven't seen the best yet, all right? You need to go to one that he's facilitating. And in addition to meeting him that day and learning more about his work with the Department of Justice, a true friendship began. I have grown to respect him, to love him, to care a lot about him, as well as our other panelists. And so please, let's give all of our panelists a big round of applause. All right, we are going to start, and we can just start here from the left and go to the right. Many individuals returning from incarceration face significant barriers such as housing, employment, and access to health care. Not all of those challenges necessarily have a political or civic solution. From your leadership perspective, what's one or two that do?
Okay, so I'm the first. I'm going to preface this by saying I'm one of the least experienced on the panel here, and I'm very grateful, and I have been completely blown away by the amazing work that all of you do, and every single person in this room does. And so, in terms of, to answer your question, in terms of my work, thinking about substance use disorders, and I think one of the biggest things that we are working on to examine what could happen with this in North Carolina, that we are thinking about, is when we think of substance use disorders, substance use related conditions, we think of them as a health condition and not something that somebody should be incarcerated for, right? Somebody should be treated for, and we need to receive treatment. So I think some of the biggest things that we are thinking about that North Carolina could do, and we have big data and big computers, and so we can run simulation models to think about what would happen if North Carolina decriminalized drug use and substance use disorder, or having drugs on you, and how much that would reduce incarceration, and that could then reduce the trauma and harm that comes after incarceration and improve people's lives. So that's one of the things that I think is very important.
Thank you. Yeah. Brandi.
Thank you, Brian, and thank you for the opportunity, and thank you for all of you in this room. Today, I have no intentions of being politically correct, even as a politician, and I want to keep it all the way real. So, to answer the question, I think all of the issues are both political and civic, because if we look at what the word politics even mean, right, from a Greek perspective, it is affairs of the city. So in that case, it means anything within that city is of affair, which is political, and that means it affects all of us. And one thing that I want to do is continue to break the stigma that says that's a them issue and change it to that's an us issue. So we want to celebrate our legislators who signed on to Reentry 2030, and our former Governor Cooper, who did the Executive Order 303. But it does not stop with them, because there's an accountability piece there that is still necessary from us. And when elected officials fall short, we need to be right there picking the baton. And if I'm right, this is a room full of people who didn't wait on a politician to give them permission to go and do the work that needed to be done. So I don't expect that we would just simply sit and wait for that. But all of these issues, even if we think about what politics is and what it means, it's just a decision that's made amongst people. And it also identifies the power of the relationship between those people. See, our Reentry Council started in 2017, and it kind of disseminated for whatever reason, fizzled out. But politics is what reintroduced the Reentry Council idea to us as Wayne Community College, for us to serve as the intermediary agency. So I understand the game of politics. It's about playing politics when it comes to people's lives and their transition, and not just for those people who are coming out of incarceration, but for also those people who are just as involved and just as impacted. They are just as important as we continue the conversation about reentry and whether it's political or civic. So my answer to that is all the above.
Thank you. Thank you.
Thank you for the question. I want to echo my colleague from Chapel Hill. The failure of the political system to address substance abuse and mental health, and the incredible need for self-medication that goes on in this state and in this country, it's unpardonable. It's unforgivable to not address these in a systematic way that across the board. We've learned from initiatives like stepping up jail management of meds and making sure that folks have their meds for 90 days post-release so they can become stable. We've learned that's 10 years this year, is celebrating the National Stepping Up Initiative. And those types of programs, the money has to come from somewhere, and if you run the program for a little while, the economic benefits come back and can fund the program again, but we never stick with anything long enough because we go to the next flavor of the month or the next administration's priority or whatever. We never stick with the program long enough to get the benefit of it. And it's been up to our partners out in the field to do all that work. But government has a tremendous role, line item funding for the programs and the structure to support all the nonprofits and all the strong work going on out there in the community. So that we all know how the grant system works. We get a 3-year grant. We try to figure out what's going on for the first year and get everybody hired up. The second year we get operational about month 8, and then the third year we figure out what we're going to do for the next grant, for our next job. And we never ever get to the work and never get to institutionalize the work. We have to figure out how to line item fund some of these structural areas. The local reentry councils across the state is certainly a great step, but they're still struggling. They're spending money on bricks and mortar rent for a facility, when we should be able to house those places in governmental agencies or governmental land so they can use the money for programming and case management.
Is that them behind the table over there? Thank you, Rob. All right, let's go to the second round of our questions, and these are questions that I'm going to ask individually of each of you, okay? And we'll start right here, Shabbar. No country in our state has no county in our state has escaped the scourge of opioid addiction and overdose, but it's even more devastating for returning citizens. You have done extensive research on this very topic. Tell us about your research and some of its conclusions.
Yes. So Brian mentioned at the beginning that he has seen, and many of you have seen and heard the statistic that when people are released from prison, in the first 2 weeks after release, the death rate in that population, formerly incarcerated people, is 40 to 50 times that in the general population. Okay. If you go past a whole year, for the first year, that rate still is about 17 to 20 times that in the general population. I just want to put it in perspective, what that means. What is the general population, what everybody else is. So in the general population in the United States, every year, there are about 100,000 drug overdose deaths. People dying from drug overdoses. When you think about 17 times that, that's 1.7 million people. If the same rate that affects formerly incarcerated people affected the entire country, 1.7 to 2 million people a year would die of drug overdoses. To put that further in perspective, that's more than all the deaths from 2020 to now that have occurred from the coronavirus pandemic. That number stands to about 1.2, 1.3 million. Total. Those deaths. So these are many more, and these are deaths per year we are talking about. So that's carnage. And in which society is it conscionable to allow that? Further, people who have had experience with solitary confinement, or what is called restrictive housing, solitary confinement, or have had longer sentences, or had prior substance use related issues, those individuals have even higher mortality rates after release from prison. So these numbers just, when first time I ran those statistics, that was back in 2018, and then we have updated those numbers since. I sat at my computer and I was baffled. I was like, is this real? And I checked my numbers for days, and they were accurate. I did hand calculations, I did everything, and those were accurate numbers. We have done more policy analysis still, thinking about what policies help. Medicaid expansion in Rhode Island, when Rhode Island implemented Medicaid expansion, that reduced mortality from opioid overdoses in formerly incarcerated people. That is it's still much higher in formerly incarcerated people, even after those reductions. But for general population rates are still fraction, but Medicaid expansion helped. But what didn't help is when we looked at which population is benefiting from it. Majority of the people who are incarcerated are racially minoritized. They are, in Rhode Island, they are Hispanic and black. In North Carolina, they are mostly black, right? And when you look at Medicaid expansion's impact in reduction of mortality, it mostly affects white individuals. It's great that it affects white individuals, good, but it should affect the same way to everybody. And that doesn't happen. Why does Medicaid expansion, considering a policy that should provide healthcare to everybody and increase access to healthcare to everybody, does not reach black people, Hispanic people, and all other populations? And those are the questions we need to answer. Those are the things we are still wrestling with and trying to figure out what to do.
Thank you. Brandi, women returning after incarceration often have even more to overcome than men. We've talked about that today. Talk about that sad reality, but also give us some ways that you're trying to change that reality in your various roles in the city of Goldsboro.
So can I have all the ladies to stand up in the room really quick? And I'm gonna just ask you one question. It's a hard job being a woman, isn't it? So everybody else that's not standing, can you celebrate the women that's standing up real quick? Go ahead and sit down and take your rest, ladies. One thing I do want to say to the women is happy early Women's History Month that will start March 1st next Saturday. So shout out to us, and I hope you celebrate all year long. But one thing I have to say first is those women reentry kits is going to change the game. To all my ladies in here, I don't know if you can agree with me, but coming home after a long day and taking a face wipe to wipe the day off just sends me into a euphoric place. So to even just have something that we oftentimes don't think about is necessary. I think about the young ladies and the ladies that I work with and how impactful a face wipe is, how intentional the detail that it took to know that women value those type of things. I could be wrong, but I feel like the world views women as strong and resilient and bearer of all things, and they're right. But who saves the hero? And one thing that I learned in this work is that men are coming home faster and women are going back faster. And something about that just don't make sense to me, right? So I'm trying to figure out where is the breakdown in services. Well, I had a rude awakening about a year ago when a young lady came into my office with tears in her eyes who had just spent 16 years incarcerated. And in those 16 years, thank you to prison education, she was able to become a licensed cosmetologist and a plethora of other certifications that I will be here all day trying to figure out how to name, to include advanced Spanish, okay? And she just couldn't have access to something as simple as a feminine item. So my good sis, Ms. Doris, thank you for mentioning the number count on those pads because it is important. Just that small detail is very, very important. So what I've been doing in the city of Goldsboro is simply trying to bring value back to women and the value that we hold to sit at every single table where decisions are being made. See, in 2019, I was elected as the first Black woman to ever sit on the Goldsboro City Council. You don't have to clap for that. It's just a sad reality that certain people just are not present at certain tables. And before that, it had been 33 years before a woman had been seated at that table. And it's because sometimes society just does not welcome us in certain spaces. So shattering glass ceilings and say, oh yes, I am necessary at this table and not just this one, but every single table a woman should be present because women just bring a certain type of care and nurture that sometimes men just don't get. No offense. No offense, we're all friends and family in here today at least, okay? But just the awareness, Brian, that's important to say we have to place value back on our women because our daughters need their mothers, our mothers need their sisters, and so on and so forth. So we really gotta be intentional about being sometimes exclusive when it comes to how we prioritize services and what we're doing as it relates to women. Thank you, Brandi.
Wow. I think I'm going to move to Goldsboro before the next election.
Get some of our barbecue.
Rob, you are an assistant U.S. attorney. You represent the federal government in criminal prosecutions. In fact, you criminally prosecuted one of our board members. Raise your hand, Brent. Where's Brent? Did he have to leave? Brent Bailey, actually back in the day, we're going back 20 years or more. And it's wonderful to see the friendship that they have today and the fact that they're colleagues. But you ensure the enforcement of federal laws and the pursuit of justice in the Middle District of North Carolina. Yet I know you well, and you are one of the most fervent believers in a robust reentry support. Why?
So I've been in this game about 40 years now, and I was a state prosecutor. I've been in the U.S. Attorney's Office about 28 years. And when I was in the state in the early 90s under the Fair Sentencing Act, you were getting, less than a month a year. And on narcotics cases, guys would go in for 20 days and get time served. And I did one particular individual, had cases with him about 5 or 6 times in a span of 2 or 3 years, so much that I knew his mother, I knew his girlfriend, I knew his children that came to the sentencing, and I would sit there and break bread while we were waiting for court to start. We went over into the structured sentencing on December 1 of 1994, and within a matter of months, this cat knew the law. We were all trying to figure out the law. This guy, he's like, I'm walking by the bullpen, and he's like, Lang, give me mitigated range, and I'm done. And I said, I can't talk to you, man. You got a lawyer. I can't communicate. She says, you'll do the deal. Move the case. He sounded like my supervisor. This guy had a personality. If we could put him on a car lot, he'd sell 35, 40, 50 cars a month. He was a nice guy. I looked at him and I said, if I had grown up with this guy in high school, he would have been one of my best friends. And I looked at him and I said, what a waste, man. Look at this talent. And so at that time is when this began. And then, my faith journey was starting to run at that time, and having children and all those things in my life. And when I went to the U.S. Attorney's Office, all of a sudden people thought I knew more than I knew. They listened to me more. They didn't listen to me a lick when I was an ADA. All of a sudden I supposedly had some expertise, and I had an opportunity to become the Project Safe Neighborhoods coordinator and work on weed and seed and other things of that nature. And I immediately saw, as we tried to identify, and weed and seed's about reducing violent crime in a holistic, comprehensive way, using data to inform your prevention, your intervention, and your strategic enforcement. And I began to see where are all my violent guys coming from? They're coming from right back there on post-release, or they're on parole. And so the reason for reentry, number one, is it's smart. Because looking at the numbers in a very antiseptic way, this is where a high percentage of the next round of violent criminals were coming from as a prosecutor. And it was my obligation to look and try to identify where can we get our biggest bang for the buck. And so reentry was beginning to develop. Granddaddy Dennis Gaddy was out down there in Raleigh beating the drum already. And we're hearing these noises. I met him, 25, 26, 28 years ago at the NAAC conference, and I'm listening to this guy. I'm like, whoa, what's he got here? Do you think rationally that if we gave some opportunities to some of these guys coming home, that maybe they won't do it again? Do you think that's a viable violent crime reduction strategy, or at least a piece of it? And so it's smart. Of course, list in order: child of God, husband, father, citizen, trial attorney. That's my why, that's my who. It's the right thing to do, of course. Look, I did something in 1979 while I was in college. But for the grace of God. So I am no different than you. I just didn't get caught. Period. So, it's the right thing to do, and believe strongly. It ain't mine to give, but boy, I'll take as much of it. Grace and redemption and forgiveness. So officially, on behalf of the Middle District of North Carolina, which you are sitting in right now, you are forgiven for your past misdeeds. Welcome back. Welcome back. It's the right thing to do. It's the right way to live. Come on, who doesn't need some forgiveness? I'll take it every day. So that's why.
Pastor Dave had to step out, but if he needs somebody to fill in tomorrow, thank you. Yes. You're good. That is my former boss, as you found out earlier. Yes, thank you so much for that passion. For the sake of time, we are going to move to the three individuals who we've asked, justice-impacted people, to ask questions for our panelists. And if you would please come up here. Our three. Where is Jameson? Jameson, come on up here. And will you have a microphone ready for each of them? Let me back up behind you. And we're going to start with the question for Rob Lang. And if you have that question, please introduce yourself first and then ask Rob your question.
How you doing, Mr. Lane? My name is Jameson McLaughlin, and I served 28 years on a life sentence, life without parole, initially. One of the things that I noticed when I was in prison was that people join gangs because they need a sense of belonging that they often don't get from anywhere else. Locking people up sometimes makes it worse because the gang culture in some prisons, some of our prisons pull people in even more, especially the young men. If we must lock up gangs into prison, what can be done to help them escape the cycle of recidivism when they're released?
That's a good question. We have learned that in the state. You know, the Justice Reinvestment Act that went in 2011 recognized that by incarcerating juveniles, their increased rates of recidivism was apparent. It was at 86%. 86% of the kids going into the training and youth detention centers were coming out and offending as adults within 6 months to 2 years. And so when they reorged that, they took the number of 600, 700, 800 kids in YDCs, and now, right now, as we stand, there's like 173 kids. And so they cut that way down, and they found it was way safer and way more helpful to not incarcerate, because you have a kid from up here in Apple's church down there sitting in a stone cold blood in a little room for 9 months, and all he's doing is learning his credo and learning all the rules of behavior. So the juvenile system has learned that, and I've learned as a prosecutor to look at gang validation. My first question is, was your gang validation inside or was it outside? And when was it outside? Was it before you went in or whatever? Because a lot of people affiliate and associate inside for protection and other reasons, and they're really not gangbangers when they come out on the street. Some are. But that identification and that label ends up creating additional barriers. But we have to we have to make our proper assessments of the individuals, where they have to be specific. We know the research shows the more specific the program is tailored, the more effective it is. So if we just can't put everybody in this type of programming, the anti-gang program, we got to figure out what this guy needs. We got to get a proper assessment and get a plan, obviously, to try to keep him from going back and getting that love from the wrong place. The other thing that we do across our district, and we've done about 475 of them over the last 25 years, is talk to guys face to face when they come out about the things that they're facing, what their criminal history will face. And at that same time, we challenge them often that if you're in a group or a gang, who put money on your canteen when you're inside? You know, did the gang do a gather of money and put it in there to help you? Who paid grandma's light bill, right? Who's driving your car, sleeping with your girl, wearing your gym shoes? All those kind of things to try to make that reality of really that the gang member is not that family and that your family's your family. But, you know, supporting the family, building the bridges at home, you know, that kills about 10 stones, right? 10 birds with one stone by creating that family environment and nurturing that family so he has got a place to go home to instead of going back out on the street. But that's a tough question. That's an issue that we need to discuss, and we need to figure it out. We need to have experts talk about it, not somebody looking at a piece of paper and at raw numbers, because it's individualized.
Right. And it's great that you say that, because I went in as a juvenile. I was 17 when I went in. And if it wasn't for the grace of God, you know, my fiance back here, her encouragement, and also with the encouragement of friends like Brian Scott and other guys that was on the inside, I probably would have done the same thing. So being surrounded around positive-minded people, you know, it helped keep me focused. And, you know, not only that, but also my family's teachings growing up as well. So I appreciate you.
Thank you.
All right, and now the question for Brandi Matthews.
Hey, Brandi. I'll introduce myself real quick. I'm Barbara Kidder. I'm also formerly incarcerated, but also a woman in long-term recovery from substance use. My question for you is, you aren't just a city councilwoman in Goldsboro. I said woman, not person, because I had to change that. You're also an educator. How can we do a better job making sure people returning from incarceration get their education, and why is that important?
Thank you for the question, and thank you for being here, and I love you. So to me, education is the portal to everything, right? Let's stay locked in with the women real quick. So female, block. Single mom, block. Add a conviction, block. Degree, credential, pass. So what I didn't share earlier about the young lady who spent 16 years in prison was that I met her in March. By April, she was employed in one of our local Walmarts at our beauty shops cutting hair. And a lot of that is attributed to the access that she had to those different trades and vocational programs while she was incarcerated, and the value that those individuals working inside of those facilities placed on having the education. So it's a two-part thing. So I teach at Dart Cherry. Well, it's the Dart facility now. I'm not sure if you're familiar with that, but it's the Drug and Alcohol Rehabilitation Treatment Center in Goldsboro. And it houses all men from across the state of North Carolina. It's a beautiful thing. And now that I've stepped into this reentry space, I make it my business to share the benefits of one of your first stops when you go home is your community college. It is one of the best kept secrets in your counties, the small business center that will actually hold your hand for those who are interested in entrepreneurship. And for a lot of us who have that ball and chain and that baggage that we just have to drag around, because we know popping the tag on the word felon is not just like popping a tag on a new shirt. You have to carry that around with you, and you have to disclose it to individuals. So going to your community college and investing in a small business center that is going to invest back in you to show you how to go into entrepreneurship. I work in continuing education, so we specialize and pride ourselves in short-term training. But one thing that we didn't get to this question is, here's the issue. So we have an open door policy at the community college. So I can invite someone with a criminal background to go into our allied health program, and they can take classes like phlebotomy, and they can take allied health. But guess what? There's gonna be a block when it's time for them to do clinicals, because the facilities are going to do a background check. And once that background check comes back, they're gonna say, I'm so sorry. So we are allowing our students to go through our classes to excel in those classes, but we're not affording them the opportunity to actually go into those fields. So in the idea of trying to improve our workforce and increase public safety, we've got to put pressure on our legislators and those pen pushers to say, no, we've got to do something else about what happens when these individuals are trying to go into these fields and they are blocked because of this criminal background. So there is work to do across the board. But yes, back to your question, sis, it is valuable, and I think that it truly is the portal into everything. And I'm going to share this last story before I pass the mic. One of our participants went through our continuing education programs, and she got her peer support training. And she did an interview the other day, and she said getting her peer support specialist credential feels like having a doctorate, because now she gets to go and work with individuals just like her, sharing hope, sharing love, and sharing support.
Thank you. Thank you, Barbara, and thank you, Brandi, for that. And now we have someone to ask a question of Shabbar. Please introduce yourself.
Hey, my name is Johnny Dow. First, I'd like to thank Brian Scott and OurJourney for providing me with one of these care packages when I got out that had Narcan, because I OD'd 3 times, and it took 13 Narcans to bring me back one time when I thought it was a good idea to swallow a gram of fentanyl that I had snuck into New Hanover County Jail. And so, in this question, I've experienced it. Dr. Shabbar, research shows that it takes the average person 9 setbacks to reach sobriety. Society gives up on us a lot earlier than that, and even our families and churches give up on us after the 5th or 6th setback. Does your research show what can help us when everybody close to us gives up on us?
Yeah. Well, first of all, I'm really grateful you're here. You're here to ask this question. I'm so grateful. And yeah, your question, almost brings tears to my eyes, because yes, people give up on us, and how dare they? When we have loved ones suffering from cancer, do we give up on them? No. People have multiple heart attacks and they die, but even when they are dying, we hook them up to ventilators and everything. Do we give up on them? We know substance use conditions are health conditions. How dare we give up on people? Right? It's unconscionable. How come we call ourselves human beings and all wise and whatnot, and God's greatest creation, and BS on us if that's how we treat each other? So I'm so sorry that that's what it feels like. And to boot that, we call ourselves a society, and one of the most advanced society in this country and anywhere you go in the world. This is how we treat people. You have a health condition, we're going to incarcerate you for that. Then we are going to call it corrections, because we are correcting who knows what, and traumatize you even more. And when you come out, we'll say, oh, you do your time and then you'll be fine. No, we are going to punish you for it for the rest of your life. Yeah, what Brandi just said, there's the background check, and no, we can't let you in here. We can't get you this job. We can't let you vote. Really?
Teach that, teach.
Why this happens? Why this happens is because there is a lot of stigma. Because there is stigma, we stigmatize everything that we can, everything that we find that is, that we don't agree with. And sometimes people go through very difficult circumstances that we are very privileged to not know of, and very blessed to not know of, and some people are not. And when they do go through those difficult circumstances, all they need is more grace from the rest of us. But some of the examples of stigma are so hard. Like, we call addiction. We use the word addiction. I'm using that word now for the first time. I've been talking to you about substance use throughout this evening. I'm using the word addiction now because I want to call that word out. Every time we say addiction is a word from bygone era, when we felt that addiction word comes from the idea that you can just say no and it would be okay. It is about willpower, that we can stay away from cigarettes, we can stay away from alcohol, we can stay away from drugs. That's not the case. these things, these are mental health conditions. Where are substance use disorders listed in the medical field? In the Diagnostics and Statistical Manual for Mental Health Conditions. It's a mental health condition. And just saying, oh, giddy up, you'll be fine. But if we were depressed, nobody will give up on us, right? No, please take medications. We'll be kind to them. That, oh, you're depressed. If we are anxious, nobody would get mad at us. But if we have substance use disorder, they will put us in prison, right? So when these kind of things happen, I mean, it's unconscionable. So first, that's why I always think of decriminalization. That's one thing. Now coming back to science, decriminalization is one thing. Peer support specialists. Nobody can understand the pain that you have had, Johnny, and the hardships that you have gone through. I can't. I can cry, but I can't relate one-on-one to you at all levels. I can relate as a human level, but I can't understand all of your experience. But Brian sure can, right? So having somebody who's gone through those, who can provide you emotional support, then understands you, provide you educational support and knows what you need to learn, provides you instrumental support and knows what kind of things you need to get. And that helps. So OurJourney is doing an amazing job at that. People who have substance use disorders, states need to invest in opioid prevention centers. Johnny was brought back 3 times, right? There are people who are not that lucky and leave much too early, right? Opioid prevention centers can provide care and Narcan and link people to medications for opioid use disorder. There are treatments for these things, right? It's not just like, oh, there is nothing we can do. There are medications. That's why it's a mental health condition. That's why it's a health condition that it's treatable, right? And so provide those kind of treatments, provide access to healthcare, which people who are released from incarceration don't have. North Carolina now has Medicaid expansion, thank goodness, but how long does it last? Nobody knows, right? People need also a lot of people who are formerly incarcerated and have substance use disorders, because substance use disorder itself is a mental health condition. There are other mental health conditions. And when you have multiple of those, it's even harder. So getting all of that care is very, very, very important. And without that, even a person who was not incarcerated can't make it. How can we expect someone who has had all the trauma from incarceration, all the multiple visits to solitary confinement, all the years of staying away from your family, not having housing, not having access to care, not having employment, all the social connections being broken, and then we expect them to come out and live normally among us.
Hear, hear. Teach, brother, teach. Preach on.
So, first of all, let's give a big round of applause for those who asked those questions. Tough questions. And let's give a huge round of applause for our panel. Thank you. Thank you so much.